Modern Dental Assisting, Chapter 31, Assisting in a Medical Emergency. A medical emergency is a condition or circumstance that requires immediate action for a person who has been injured or has suddenly become ill. You must be prepared to respond immediately. Your knowledge and skills could mean the difference between life and death. One of the most important ways to prevent a medical emergency is to know your patient. You want to have open communication about the patient's health and have a completed or an updated medical history. The front desk assistant is responsible for ensuring the patients update this information as they enter the office. Most emergencies that occur in the dental office are caused by combined stress of the patient's daily life and then also the apprehensive of going to the dentist. Emergency preparedness. Successful management of medical emergencies in the dental office requires preparedness, prompt recognition, and effective treatment. Ongoing observation of the patient is an important part of emergency preparedness. Your emergency protocol is going to include a written, outlining steps to follow in case of an emergency, each staff member having an assigned role, emergency telephone numbers, references, and routine drills. A medical emergency can occur at any time. A symptom is what a patient tells you, but the sign is what you observe. Every member of the dental team must be skilled in taking, assessing, and recording vital signs, CPR, Heimlich maneuver, and operating the AED. In most offices, a standardized emergency kit is equipped and organized with emergency supplies. Maintenance of the kit consists of routine check of supplies to determine whether they are in working condition, weekly examination for expiration of drugs within the emergency kit, and daily check of oxygen tank or tanks. Oxygen is the most frequently used drug in a medical emergency. The ideal agent for resuscitation of a patient who is unconscious but still breathing. A portable unit with tanks of oxygen may be stored where it can be moved quickly into a treatment room if needed, and the oxygen tank is always color-coded green. Emergency responses. Responsibility as a dental assistant includes recognizing signs and symptoms of a significant medical complaint, providing appropriate support to the dentist in implementing emergency procedures, assessing a medical emergency, including unconsciousness, altered consciousness, respiratory distress, convulsions, chest pain, and mental status. Common medical emergencies that are experienced in the dental office include syncope, procedural hypotension, cardiac emergencies, cerebrovascular accident, hyperventilation, asthma attack, allergic reaction, epileptic seizure, and diabetes emergencies. Documentation of an emergency. Full documentation of the details of an emergency is essential. After such an emergency, the dentist will make extensive notes in the patient's record to explain what has happened, indicate the treatment provided, and describe the patient's condition at the time he or she left the office.